Hi, my name is Jacqueline Rios. I currently attend Turo College in New York City. I am pursuing a degree in special education, grades 1 through 6, and this video is for a special ed 602 class with Dr. Levy, and this focuses on what are emotional and behavioral disorders and how it affects children in the classroom. I hope you enjoy it. Thank you.
What are emotional or behavioral disorders? Emotional or behavioral disorders is a disability characterized by behavioral or emotional responses that are very different from the norms and referent groups and have adverse effects on educational performance. It is an emotional disturbance in students that have limited control of their actions. This emotional disturbance can sometimes be referred to as a conduct disorder. A conduct disorder is when someone acts out a behavior, usually negative or destructive. These disturbances can affect a child's performance in the classroom. These students are unable to learn, build relationships with other students and teachers, can have physical symptoms, and are easily stressed out over events in their environment.
Emotional or behavioral disorders can also coexist with other disabilities and disorders. They are put into 3 categories, which include externalizing behaviors, internalizing behaviors, and low-incident disorders. Externalizing behaviors are behaviors that are directed outward towards others. Examples of these kind of behaviors are children with ADHD. These children have tantrums, violate the rights of others and social norms, are defiant, and can physically harm others as well as animals. And they're also hyperactive. Internalizing behaviors are behaviors that are directed inwards towards oneself. These behaviors include depression, anxiety, children are socially withdrawn, they are teased and neglected by peers, they have phobias, they have low self-esteem, can be suicidal, and can be anorexic or bulimic and have panic attacks. Low-incident disorders are disorders that don't happen very often but carry extreme effects on the child, such as schizophrenia. So schizophrenia is when a person or child suffers from delusions and is disassociated from reality. These children have difficulty in school and spend most of their time in a hospital. Causes of these disorders are sometimes hard to identify, but they can include many factors, which include biological, their home life, and their environment. Schools also have a huge influence in a student's life that may have a behavioral disorder.
Students with emotional or behavioral disorders need support from both their teachers and parents. What they do can affect the individual tremendously. There are strategies for improving learning outcomes for students with these disorders. Educators can add the following when trying to improve student learning, which can include intervention plans, behavior management, home-to-school communication, peer involvement, classroom structure, and supervised free periods. When in the classroom, educators need to make sure that their students' behavior is controlled so that way their learning environment is not disrupted. Sometimes it is hard for teachers to control every student's behavior in the classroom, especially children with special needs. Educators use behavior modification procedures to help them to get the cooperation of students and make sure they're engaged in their learning. This allows the student to learn what is expected of him or her and how they should act in the classroom and towards others. In every classroom, teachers should have a set of rules that students must follow. These rules are put into effect so their classroom can have few interruptions and are able to learn effectively. No classroom is perfect. Children act out, get bored, have emotional or physical disabilities, and may be hard for them to control their emotions. Setting rules in the beginning of the school year will set the tone for the rest of the year. Teachers must be concise and firm when giving the classroom rules to students. They should also have classroom rules posted somewhere in the room where students can view it at all times.
Sometimes for children with special needs, especially those with behavioral or emotional disorders, have a hard time following the rules. Behavior modifications can either help or make their behavior worse. In the end, all students, whether they have a disability or not, need to follow the classroom rules. Using behavior modification procedures in the classroom can be effective with students with emotional disorders. They will learn how to follow the rules in the appropriate ways on how to act around others inside and outside the classroom. Sometimes they may not be able to control themselves, but that doesn't mean they can't follow the rules. Using behavior modification procedures with a student with emotional disorder can backfire on a teacher sometimes. The child can become aggressive and violent because they don't want to listen. We want to teach them that they must follow the rules, but we also need to remember that they cannot control their emotions at times. A teacher can set up a system for behavior for every time a student behaves well and does their work or their homework, or if they put away materials that they were using. The teacher can give them a token, and the tokens are used for positive reinforcement. And if a student has a certain amount of tokens, then they can choose something extra that they can do, whether it be free time or they can choose something that's in a treasure chest. The treasure chest can have pencils, erasers, coloring books, stickers, anything, maybe a little toy, and they can choose from that. Or they can also choose to have a party for their classroom. The teacher can set the classroom in table groups to get the tokens and also give them out individually. So they can either give them out as a group or they can give out the tokens to individual students. This will help the student try to be positive and do the right thing because they know that they're going to get something for behaving. Now, if they don't behave, then they don't get a reward. And, this will help them to follow the rules, and it can be rewarding for the student. This can also work for negative behavior. You can have a chart that has 3 colors on the chart with their name on it, and underneath their name, you can have a green card, a yellow card, and a red card. Every student starts off with a green card, and every time they don't behave, the color gets changed. Yellow is for a warning, and red is that they will get a letter to their parents. Every time they don't follow a rule, they move to a different color. So this will help them understand that they can get rewarded for doing positive things in the classroom, and that they could also not be rewarded for negative behavior and possibly get a letter at home.
When working in the classroom, it can be hard for a teacher to work with a student that has an emotional or behavioral disorder. I hope this video was informative and helped to describe what an emotional or behavioral disorder is and how it affects a child in the classroom, and the techniques or behavior modifications that a teacher can use that can help the child learn their rules and have an effective learning environment. Thank you very much.